Maggot therapy is a biotherapy that employs the use of green butterfly larvae to clean the dead tissue in necrotic wounds. Necrotic wounds form a huge burden for Kenyans, with about an estimate of about 225 patients suffering from chronic wounds per year. Surgical wounds account for the highest number with 45%, with infected wounds forming about 13%, fugated wounds forming about 3%. Pressure sores and leg ulcers each form about 9%, and the rest are trauma-related wounds. Maggot therapy is a new technology that started during the First World War. Kenya is the third country from Egypt and South Africa to introduce maggot therapy. A proof of concept has been done alongside KALRO, University of Nairobi, and KNH. We have been producing maggots since 2013. After the establishment of our green butterfly insectary. Since then, we have been maintaining the colony of the flies. The maggots are normally packaged depending on the request by the healthcare provider, either as free range in free range bottles, or prepared or packaged either as also the biosac.
The adult flies, that is the Lucilla sericata flies, will give us the eggs. We now wash them aseptically. We are sure that the eggs are now 100% aseptic. For incubation, we use egg yolk media. You put your egg yolk media or egg yolk powder in an oven. You give it a temperature of 120 degrees Celsius for 2 hours. From that, you are going to now mix with some distilled water to make a paste. You use a spreader to place your the Lucilla sericata eggs on the plate. Then you spread evenly. We are going to incubate the eggs for 24 hours. After 24 hours, our maggots will have appeared. Again, we do our aseptic condition.
This therapy provides a cheap alternative in the wound care sector. You realize that conventional methods are very expensive, ranging between 60,000 to 150. With maggot therapy, with only 10,000, one can benefit from this method. We supply maggots to various health institutions and home-based caregivers. KNH is our major customer because being part of our main collaborator, which established the maggot, which introduced the maggot therapy for use in medical care. We also deliver maggots to Mwai Kibaki Hospital in Udhaya, other private hospitals including the Nairobi Hospital, the Lions Sight First Eye Hospital, and many others.
I am a wound care specialist based in Kenyatta National Hospital, Maggot Debridement Therapy, which is basically what we say it is a biological means of removing dead tissue from a wound. We should remember that what actually makes the wound worse day by day is the amount of necrotic tissue, or what we call dead tissue. This is done by means of several enzymes which the maggot has. Actually, there are about 8 which are documented. Some digest the proteins, some digest even fats, some have antibacterial properties which kill bacteria. We have to identify a patient which meets the criteria, and the criteria basically is a wound which has a lot of dead tissue, what we call necrotic tissue. Once you identify that type of a wound, we have to order the maggots from KALRO, and then we apply on a wound. We clean the wound normally, and instead of applying a dressing, which is done conventionally, we put the maggots in the wound. And I have to insist that they are live maggots. They are not dead. We have to introduce the live maggots, and they usually introduce when they are very tiny, actually around 24 hours old. And when they get the dead tissue, they feed very fast, and within 48 hours, they would have cleared all the necrotic tissue and leaves the wound very clean. Usually the calculation is 4 maggots per centimeter square. 4 maggots per centimeter square of a wound. So which means you have to estimate the size of the wound before you order. If it is a very big wound, it may require up to 2,000 maggots. If it's a small one, it may require only about 20 to 50 maggots. So usually after the 48 hours, we do what we call euthanasia. We euthanize them. Because we don't want them to go to the next stage, which is pupa, and then adult. Because before you know it, you will find the whole hospital full of the blue flies. So we usually make sure that we dispose like clinical waste. The beauty of maggots is that unlike a surgeon can just use the scalpel to get to the surface of the wound, but the maggots usually go deeper than that. They can go as deep as 15 to 50 centimeters deep, looking for the dead tissue. So the debridement is usually complete, and within 48 hours, the smell is gone. Because when we compare with the surgical debridement, when the surgeon does the debridement, it doesn't reach those far areas. So the smell will continue, the infection will continue, and the festering will continue. But for the maggots, it does that 100%. The second implication is, of course, the cost, because cost of surgery is too expensive in this country. And actually, one simple surgery like debridement, removing the dead tissue, is called debridement, using surgical methods. A patient has to go to theater. A patient has to go through the anesthetic machine. A patient has to be given antibiotics. A patient has to be prepared for about 1 week. If the patient has poor HB or the blood is not enough, we must look for ways of raising the HB. Maggot therapy can be done at home. You don't need to go to hospital. Maggot therapy can be done anywhere in Kenya, because as soon as the maggots, the lap arch, it can take up to 72 hours for them to die under some circumstances. But when they are in frozen condition or when they are in cold box, they can stay even longer. So maggots can reach any part of this country. So it has been a journey from 2013. That is when we did what we call proof of concept, the KALRO, in collaboration with KNH and University of Nairobi. We started with 50 patients. And then after that, we have been doing on average of about 8 patients per month. That is KNH alone. But the others which we do in other hospitals these days. So it spread from KNH to the private hospitals around. Then we have gone outside KNH. We have done patients in Kiambu. We have done in Machakos. The farthest we have done is Migori. And all the maggots come from Nairobi, KALRO. So the reception has been good, because what we usually say, for any treatment, so long as you inform the patient very well, you talk to the patient and tell them what happens from day 1 to the last day, the buy-in is usually very good. And considering that these are patients who have suffered with wounds for some or up to 25 years, the only that fear of insects is always there from both the patient and the caregivers. So we have done a lot of explanation, but much more needs to be done. There are patients who fear to see the maggots, and there are 2 methods of applying maggots, by the way. One is the open method, and the other one is closed. In the closed method, we put maggots in what we call a biobag, where they can secrete the enzymes without necessarily coming out, which digest the dead tissue, and then they sip the matrix which comes out of it. So for that, for those patients who have a lot of fear of seeing the insects, that is the method we use. But for the other ones who have been explained to and they understand the process well, we use the open method, where we just put the maggots and they roam all over looking for the dead tissue. So those ones who have been struggling with wounds, let them know that there is a solution. We as medics, as research organizations, we always look for cheaper solutions, and whichever kind of a wound you have, it is going to heal so long as you come to the hospital and get the correct specialists.